You might have heard of IBS or irritable bowel syndrome and wondering if that's the cause of your symptoms, or perhaps a clinician has diagnosed you with IBS. In this video, we're going to find out a little bit more about IBS and what can be done to help. So what is IBS? It's a really common long-term condition of the digestive tract. We're not exactly sure what causes it, but we do know there are certain triggers that make it worse, and it affects around 1 in 5 people at some point in their life. It usually affects people when they're about 20 or 30 years old and onwards, and it affects twice as many women as men. Symptoms of IBS are related to what's known as an upset tummy. So you often get tummy pains, you get diarrhea, sometimes constipation, sometimes both. You can get mucus in the stools. Often the tummy pains are made worse by eating and relieved by opening your bowels. You can get changes in your bowel habit, so you can get some urgency, you can get straining, you can get the sensation that you haven't actually emptied your bowels properly. And some people can also suffer with other symptoms like back pain and tiredness, headache, and even nausea. Usually we need to do some additional tests to rule out other causes of your symptoms, including inflammatory bowel disease and celiac disease. So this might be a blood test and a stool sample test. IBS itself doesn't pose a threat to your physical health and doesn't increase your risk of any sort of bowel cancers or disorders. There are also symptoms which we call red flag symptoms. And these are symptoms which mean we need to investigate in case there's anything more sinister going on. So please do go and see your GP straight away if you have any of the following: unexplained weight loss, a lump around your back passage or your tummy, bleeding from the bottom, unexplained change in your bowel habit, or symptoms of anemia, which might include pale complexion, feeling very tired, and shortness of breath. Management: lifestyle changes. Maintaining a healthy diet, trying to stay physically active, and drinking plenty of water is a really good start. Triggers in the diet include things like caffeine, alcohol, spicy and fatty foods, artificial sweeteners, chewing gum, and processed foods. So if you can, try and cut these down, or even more brilliant would be if you could cut them out altogether of your diet. Good foods to include in your diet include things like linseeds, which you can buy from the supermarket, and porridge. These help reduce bloating and tummy pain. For people struggling with IBS that's mostly constipation related, it might be a good idea to increase fibre in the diet, and you may want to consider getting some laxatives from over the counter. For those who've got more of a diarrhea IBS, it might be a good idea to reduce the fibre in the diet, and you might want to go to the pharmacy and get something like loperamide, which is known as Imodium, to help with the diarrhea. Other medication that can be bought from the pharmacy include things like Buscopan and peppermint oil, which some people find helpful for the abdominal cramps and the bloating. It can be a good idea to try and avoid foods which are hard to digest. That includes things like broccoli, cabbage, onions, beans, dried fruit. And some people like to try a certain specific diet for IBS, known by the acronym the FODMAP diet. I'll include a link below to give you a bit more information if you want to read on. It's essentially an exclusion diet to keep these certain foods out of the diet, but because a lot of these foods are really important within our diet and missing them may mean that you'll lose out on some important nutrients, it's usually best done with advice from a dietitian. So if you want to find out more, read on the link in the description. Improved sleep can also help with IBS. So try sticking to a good bedtime routine, get some time outside in the daytime, avoid screen time too late at night, and too much alcohol or caffeine too close to bedtime. I've got more information about sleep in one of my other YouTube videos, so have a look if you'd like to learn more. We've actually all experienced symptoms of IBS at some point, especially just before an exam or something that causes us some stress and anxiety. So it's a good idea to acknowledge if you are struggling with any stress, anxiety, or depression, and see if you can manage this or get it treated, because in doing so that may help your IBS. I've also got a video on depression if you want to watch that, also on my YouTube channel, which has got lots of tips and help for this. Probiotics. There isn't brilliant evidence yet on the use of probiotics for IBS, or anything actually, but the evidence probably will be coming. Some people do find it helpful, and probiotics are known as these kind of good or friendly bacteria that we find in things like live yogurt. So you might want to consider including this in your diet, or even taking probiotic supplements. There are loads of probiotic supplements you can buy. Ones that are typically found to help IBS include lactobacillus and bifidobacterium. What I would suggest is do some research, have a look around, and see what might be helpful for you. We do know that you've got to try at least 4 weeks to decide whether or not it is helpful. Antidepressants. If despite making all these lifestyle changes and over-the-counter medications, you're still struggling with abdominal pain related to IBS, then your doctor may suggest using a drug which is typically used for as an antidepressant. This may include amitriptyline or citalopram. Bear in mind they do take about 4 weeks to work, so your doctor usually will want to review you and see you are after these 4 weeks. Psychological treatments. If your symptoms have been going on for longer than a year, then your doctor may suggest trying some psychological treatments. And this may include psychotherapy, hypnotherapy, or cognitive behavioural therapy. We're learning more and more about what's known as the gut-brain axis. And we know that the gut's nervous system is so extensive it's often referred to as a second brain. So these treatments may help with pain perception and anxiety and stress. So in conclusion, IBS is really common, but often not really talked about and quite debilitating. But the good news is there is loads of changes you can make to your lifestyle which will probably help. If not, you can buy over-the-counter medications, and if all of that still isn't helping, then come and see your GP and we'll do our best to help as well. Hope you found that useful. Check out my other videos and I'll see you again on my next video. Thanks.